Well, parents and their kids are managing a lot of ups and downs these days during the pandemic. But imagine adding the mix of chronic skin conditions that can come up with intense itching, sleepless nights, and painful skin lesions. That's the reality for Ashley Ellis, mother to a 9-year-old daughter with severe atopic dermatitis, also known as AD. AD is the most common form of eczema, a skin disease that causes rashes, dry patches, and redness or darkening of the skin. Here to talk about navigating the disease and to help raise awareness are dermatologists Dr. Mercedes E. Gonzalez and Ashley. Thank you so much for joining me today.
Thank you for having us.
Now, first, Dr. Gonzalez, tell us what are the most common symptoms of AD and how does it impact children?
Sure. Atopic dermatitis is the most common form of eczema, and it's a chronic inflammatory disease that's characterized by itchy skin rashes that come and go. In moderate to severe atopic dermatitis, we know that the skin and the immune system are highly sensitive, and it can react to even the slightest triggers like irritants and allergens in the environment that can trigger the skin to react with these itchy, red, sometimes dark, dry, rough patches that can sometimes be cracked and open, and these can come and go. And really the most burdensome associated symptom is itch. The itch can be persistent and relentless and really debilitating for the affected person. And we know in the United States, it's estimated that 2 million people are affected with moderate to severe uncontrolled atopic dermatitis.
Absolutely. Now, Ashley, I want to let you know this subject is close to my heart. I'm also Dr. Gonzalez because my firstborn daughter also had AD, and she was diagnosed with it at 4 months old. So I definitely can relate to. I can definitely relate to your experience. So tell me, Ashley, what about your daughter's diagnosis, and has it been like for you and her with her living with AD?
Very, very similar. So Hadley is my oldest as well. She's 9 now in 4th grade, but she was diagnosed when she was 4 months old. So she kind of started out with those little red, itchy patches in the folds of her skin and her face and that kind of thing, and it just got worse and worse. So itchy, open skin. She would scratch during the night, and those lesions would open up, and then they would bleed. And the blood would get all over her pajamas and the sheets. We'd have to change those every morning. We had scratch sleeves. It led to a lot of pain. We had to pull her out of preschool because those teachers couldn't manage it. And it just went on and on. So it got worse. I'd say the worst part was when she was 2. We had to go to a lot of different providers to try to find somebody to help us manage it. And now that she's older, the hardest part in school is trying to sit still. Itch is her biggest symptom. It's affected her mental health with anxiety, panic attacks. She's nervous about going to doctor's visits and what are we going to find out? What's going to be the problem now? And that kind of thing. It's affected my husband and I, having to take off work, having to deal with it. She skipped meals. She's had issues with relationships, of course, with pain, with her brothers, having to revolve around her treatments, and they think that we spend a lot more time with her and things like that. So it's affected our entire family for sure.
Right, indeed. And I appreciate you sharing your journey with us today. And just know that you're not alone. Our stories are very parallel in terms of the things that we've gone through as parents with children living with AD. Now, Dr. Gonzalez, tell us, there's definitely a lot of misconceptions that come with AD. Tell us, Ashley, some of the misconceptions that you've experienced while raising your daughter, and Dr. Gonzalez, tell us some of the misconceptions that you've heard from parents who bring their children in to be tested or treated.
Yeah, so with our particular situation, when Hadley was a baby, I would be worried about what was going on. I was pretty desperate at that point with going from provider to provider, and I would hear things like, it's no big deal, every baby has eczema, she'll grow out of it. And that's not the case for Hadley in particular. Not every baby outgrows it. I heard that when Hadley is in a public situation like swimming or on the playground, other adults and children will ask if it's contagious because they can see it on her skin. And so eczema is not contagious. Atopic dermatitis is not contagious. So her swimming and being on the playground does not affect other children. And for Hadley in particular as well, she has scalp symptoms. And so other children have asked her, do you have dandruff? Do you not wash your hair enough? That hurts her feelings. And so I've tried to help her to advocate for herself and say, no, this is part of my eczema. I just live with it. But that does hurt my feelings when you bring that up. And that's just part of my condition. And so we work through that, pretty regularly.
Right, absolutely. I've been there. Now, Dr. Gonzalez, I can tell you that my daughter was born in the early 90s, so unfortunately there weren't any type of awareness back then, but now there is. Tell us more about the Understand AD initiative and what it hopes to accomplish for parents.
The Understand AD program is just that. It's an awareness program to raise awareness, and it's supported by Sanofi and Regeneron in partnership with the National Eczema Association, who we are here on behalf of today. Understand AD brings together different perspectives from real people who are navigating the different challenges associated with atopic dermatitis. And through a series of educational videos that feature Ashley, myself, and 2 others, we answer some of the most common questions, and we discuss some of the unique challenges that are involved in navigating this chronic disease. And through the videos and the educational resources out there, we hope to really empower others, empower them with the knowledge, and empower them with community so that they know that they are not alone. And we hope that people listening will visit the website understandad.com and access the videos as well as the educational resources there.
Absolutely. I'm so glad that this initiative is available now for parents and patients alike. It's definitely going to help a lot of people to know that they are not alone in AD. And again, for more information and to visit the Understand AD website, just go to understandad.com. There's tons of resources there, information, and even community. So that way you cannot feel alone in your journey with a child who may be experiencing AD. Thank you so much, Ashley, for sharing your journey with us. And thank you, Dr. Gonzalez, for joining us today. It's been a pleasure.
Thank you so much.
Thank you so much for having us.